I can go over and I can also show how we will demonstrate, or like how we will utilize all those codes to the payable bill. Everything I will be guiding in today's session. Okay, so please be in the webinar for until maybe 1.5 to 2 hours, so that you will get a clear picture on the complete course as well, and also you will get a good idea on what is this medical coding is all about. Okay, so yeah, I hope my screen is visible. So yes, so first we will just have a introduction on medical coding. We will understand what it is and how it will be converted into codes. Okay, then we will get into other subjects. So now see here. So what is this medical coding? So to begin with, in a simple way, okay, in a simple way, I'll put it. So if you compare between India and US healthcare system, okay. So in India, average, if you take 10 members, out of 10 members, 1 or 2 members will have the health insurance. Okay, maybe they are a corporate employee. So from their company, they might have their health insurance. Okay, or they are financially good and they can opt for health insurance premium and they have got the health insurance. Likewise, out of 10 to 15 members, 2 or 3 members will have the health insurance here in India. But in US healthcare, what will happen? 92% to 95% of the people will be insured. Okay, they will have the health insurance. Remaining some 5 to 6% people will be uninsured. Okay, so now whenever patient goes to hospital or a clinic, how do they pay, or how do they give the money to the service that they have received from the doctor or the provider end? It will be through insurance only. Okay, everything, whatever the payment things are there, whatever the service they will take, they may take X-ray, they may take ECG, or they may take some general panels or lab test, anything, whether it could be a procedure or diagnostic, anything, the payment will be done by their insurance. Okay, whatever the insurance they have currently having, the patient, that insurance will be paying the money in behalf of the patient, okay, to the provider. So now so just see here. So first I'll just give you some practical knowledge so that I can go and see the theory. Okay, so now if you just see this image, okay. Okay, so just see this image. So consider it's an US healthcare system. So provider is nothing but doctors, and payers are nothing but the insurance companies. Okay, there will be government insurances will be there, and there will be commercial insurances. Okay, so those are the payers. Then patient, and I am a patient. Okay, or you are a citizen and you are a patient. So this triangle relationship what we have in the US healthcare will be having one particular bridge. Okay, so the bridge will be medical coding and billing. So utilizing medical coders and utilizing medical billing process, the provider will get reimbursed from the payer. Okay, patient will go and meet the provider, will take the service from the provider. Now whatever the patient services are there, okay, the service money should be reimbursed through their payers. Okay, so now payer will not understand the doctor's note. Okay, the payer will not be able to read all the medical records. They want some codes, because all codes will be tied with some dollar values. Okay, if you are taking one injection, maybe the injection code may be for $50, or based on state and based on the state government, some like each state will have the certain variation. Okay, in Tennessee state, maybe one injection cost $50. In other state, okay, in other state maybe it may cost $70. Okay, likewise, based on the state government, the price will vary, but code will remain same. Code will be universal. Okay, if you are using code 1 for injection, this 1 for injection remains same completely through US healthcare. Okay, but coming to price, maybe as I said, in the Tennessee state it is $50, in another state it is maybe $70, but the code will remain one only. Okay, so that is what. So the insurer will get to know the codes, and they will see the tied payment, or how much dollar value that the CPT code or the ICD code is carrying, and accordingly they are going to reimburse for the provider. Okay, so between these three people or three entities, your medical coding and medical billing will come. Okay, so this is a very big pillars in the revenue cycle management. Okay, so we will understand what exactly it is, everything. So it's just in one idea to have, or to you should visualize something, right? So for that I am giving you a overview. So now coming back to our theory. So in the theory, you can see that what is medical coding? Medical coding is a process of translating medical diagnosis, procedure, and treatments into universally recognized alphanumeric codes. Okay, so you can see universally recognized alphanumeric codes. So now they are saying translating medical diagnosis. So in the general medical record, what you can expect, you will see this is a live chart. Okay, so this is you are a medical coder. Assume you are a medical coder and you are having one medical record from some patient. Okay, say for example patient name is Emily. Okay, one Emily is patient name, and you have a medical record. So what and all it will be there? There will be chief complaint. Chief complaint is nothing but why this patient is here in the clinic today. Okay, so she says, or patient complains of burning urination, right knee pain, and left forearm pain. These are the complaints or the problem that patient is having. Okay, so next you have, again there is a elaboration for the problem, and then what are the things that provider is doing, analyzing, examining, everything here you can see in the medical record. Okay, so three things in every medical record. As a medical coder, you should know three things: why this patient is here, okay, what is the concern of the patient or the problem of the patient, and in order to diagnose the problem or in order to treat that problem, what are the procedure that provider is doing. Okay, that is the second thing. In last, so now they have diagnosed or they have analyzed what is the problem, and they have did the procedure also. In order to treat that problem, what is the treatment methodology they are following. Okay, what the doctor did. So that is your third point. All these 3 points are important. So this is what you're going to convert from your medical record to normal diagnosis, I mean to the code format. Not everything, like many people will think like everything, it's not like engineering coding, right? It's not related to IT, it is non-IT. So you don't have to convert or encrypt everything into codes. Instead, you need to extract what is needed. All we need is what is the patient condition, what are the procedure that the doctor did in order to diagnose the problem, and lastly, okay, now the problem is sorted, the problem is being established. In order to treat the problem, what kind of treatment provider did. Okay, we need only these three things. So these three things we are going to put it in a codes. Okay, so three things will convert into codes and will submit into insurance. As I already said, all the three things will already have the some dollar value with that. So based on the complete payment, the insurer will reimburse to the doctor. Okay, so later I'll come to this chart. Once I explain the code set, we will come and we will see the what are the codes we will be able to give it for this medical record. I will explain. So now, again, as you can see, another thing that, so you are going to translate medical diagnosis, nothing but what is the problem of the patient. Is it hypertension, diabetes, or upper respiratory infection, lower respiratory infection? What is the problem? Okay, that is called as diagnosis. Procedure, as I already said, what are the diagnostics or what are the laboratories, lab tests they are performing? That will be procedures. Or injection is also procedure. And maybe if they need some kind of surgery will be a procedure. Okay, or if they want to have any kind of repair, okay, closure, like they have the lacerations, they have a cut on the hand and that needs to be closed. Okay, so that they're performing laceration repair. So that is also a procedure. So next, treatment is nothing but whether they are prescribing any tablets, Okay, any treatment methodologies, it could be tablet or it could be any kind of therapies. Okay, IV therapies, or maybe they are asking the patients to be hospitalized. So many things comes under treatment. Next, coming to universally recognized alphanumeric codes. So the code set is important. We are not like, it is alphanumeric. Alphanumeric refers to there will be numbers also. Okay, there will be numbers and there will be digits. Sorry, numbers and alphabets. Okay, then the combination we call it as alphanumeric codes. Say for example, if I want to give one diagnosis code, okay, assume diabetes. Okay, diabetes is the medical condition. So I know the code, so I am entering now. So I 11.9. Okay, sorry, E11.9. E11.9 is my diagnosis code for diabetes. So here you can see that E is an alphabet and 11, 1, 1. These two are numbers. Again, 9 is also number. So you got the combination alpha and numeric. Okay, so in this way, our code set are designed. This is how they are structured in the alphanumeric range. Sometimes you get to see complete alphabetical digit. Sometimes you see completely numeric digits. Okay, so it depends. With the code set, it depends. But when you are referring, you should know that it's a combination of alpha and numeric. So also medical coding serves a standardized language that enables healthcare providers, insurance companies, and other stakeholders communicate effectively. So not like here in India, as I said, it is like mixed of some patients will directly pay to the provider through cash, they will pay, and sometimes whoever have the insurance, they will claim for their insurance. So it is a mixed payment methodologies here in India. There is no track. Okay, like how many patients are getting diabetic every day or every month. Okay, or how many patients are getting cancer diagnosis. Okay, likewise they don't have any analysis and they cannot have that proper raw data. But when it comes to US healthcare under WHO, World Health Organization, as they have proper protocol for this US healthcare using medical coding and using medical billing, they can also see their revenue. Okay, revenue for the government, and also they can see the structured statistical data. Okay, like how many patients are above 65 year, and how many patients are getting hypertension every year, how many patients are having ESRD, end stage renal disease. Okay, how many patient requires dialysis treatment, because dialysis is free for the patients in US healthcare. They should plan the budget. Okay, based on all the statistical data, they could figure out how much money they need to put it in the healthcare system. Okay, so everything will be connected to your medical coding and billing. And then coming to, you can see this is just the visual image. So here if you see that there is a patient visit. So this is how it happens. Okay, you are a patient, you are going to one clinic. So as soon as you enter the clinic, there will be a desk. Okay, reception desk will be there. So this front desk officer, what they will do, they will collect the data. So this is your initial step or the first step. So what this front desk officer will do, they will collect your data, like what is your date of birth, what is your name, which insurance you are having currently, active insurance, whether you have a private insurance or you have a Medicare, you have a government insurance, what kind of insurance you are having, and why are you here today, like what is your problem, you need what service, everything will be questioned in the front desk itself. So whatever he may say, like I have Medicare insurance. Okay, Medicare insurance is a government insurance. So he may say I am having Medicare insurance. So when it comes to government insurance, they may not give you so much benefits. Okay, they may not give you enough coverage. So the front desk officer needs to verify whether whatever the service you are looking for today to with this provider, will your Medicare insurance is payable for the service or they're not ready to pay. Sometime, if you just take an insurance, every insurance have their benefits plan. Okay, they will give you set of rules and regulation. What are the service they are going to cover, what services they are not going to cover. Say for example, they will say like, if you get admit, we are not covering for your bed charges, we are not covering for your bedsheet charges. Okay, we are only covering for your medical condition. Likewise, you will have the list. Okay, so this eligible, I mean, this front desk officer needs to verify all those things. And once she understand that, okay, his insurance will work for the reimbursement, then he will be moved to the provider section. Or he will, if the insurance is not ready to pay for that service, this front desk officer will let the patient know that maybe this service will not get covered under your insurance, so that you should better have the other plans. Okay, either you should pay directly to the provider, or some alternatives will be there. So she will make this very clear, and she will then pass, I mean, ask the patients to go and see the provider. So what the provider will do, the provider will examine the patient, he will understand the problem of the patient, and to diagnose his condition, he will be ordering some test, procedure, labs, all those, and he will be also giving the treatment. So whatever the service here happening between the, or whatever the service this provider or the doctor is rendering to the patient, everything will be recorded. Okay, everything will be recorded. So now the doctor will not write a note, instead they will record everything. Okay, so they will record, and then they will transcribe the whatever the recording is there, that they will transcribe to text format. Okay, so the text format will be there in the reports. Those reports will have the EHR system. Okay, EHR or EMR, electronic medical record, what we say, it will be very secured, and through secured manner only the organization or the entity wherever the medical coders are there. Say for example, you know the companies, right? We have so many medical coding companies. So those companies will have those the contracts, B2B contracts will be there. So through the contract, there will be a secured manner. I mean, there will be having all the HIPAA compliance rules and regulations will be there. Through all those secured manner, they will receive the medical reports. Okay, say for example, you are a medical coder in so and so company, and you are sitting and you are seeing your system. There will be a medical coding software. Through your software, you could see the medical record of this patient. Okay, so what you have to do now, you have to read the medical record, and I have already said you need to identify what is the patient condition, what is the procedure that they are performed, and what are the treatments that they have given. Okay, all these three things you will extract from the medical record, and you will put it in a charge entry maybe, or in the software you will keep, and you are going to submit. Okay, once you submit, it will go to insurance. Some companies will have both submission and coding process together in a software. Some companies only may ask you to code, and they will do the submission portion. Okay, so it works in a different way, but your basic primary work is to convert all these three things, important things from the record, into the code format. Okay, so for everyone able to understand? Yes, no, please.
Yes.
Okay.
Yes, ma'am.
Yes.
Okay, thank you. So this is the workflow. Okay, this is how the medical coding will happen in a real time. So now let's talk about the differences between outpatient setting and inpatient setting. So in medical coding, as you know, like we are talking about complete US healthcare system. So when we talk about a healthcare system, there will be a minimal problem, there will be an extensive problem. Okay, minimal problem include maybe patient is coming for mosquito bite. Okay, that is also one problem, that is also requires some treatment, or minimal, like some kind of wound dressing. All these are minimal problem, cough, cold, and nasal congestion. All these are very minimal problem. But when I say patient is having myocardial infarction, or patient is having stroke, okay, patient is having COPD, asthma with exacerbation, likewise when some complicated conditions are there, patient will refers to go to hospital. Okay, not the clinic. Instead they go to hospital. So just in general word, understand, outpatient, take an example of small clinic. Okay, small clinic, it's kind of primary care clinic where provider will be individually running the clinic, and they will have the limited medical equipment. They will not have any advanced equipments. Whatever is needed for minor problems or maybe a moderate problems, that equipments will be there in the outpatient clinics. Coming to inpatient, that is, think about a big multi-speciality hospital. There you have all the different departments. Okay, there is a nephro department, there is a neurology department, and again there is a surgery department, like cardio department. Okay, and there will be a OPD, outpatient department. So there's so many different things will be there under one single roof in the hospital. Okay, so you as a patient, based on your problem, based on what kind of treatment you need, you will decide to go for an outpatient setting or an IP setting. Okay, so now to refer this outpatient means you have a problem, you're going to clinic, and you're not going to stay overnight in that clinic. Okay, so you are just going and you're taking the treatment. Maybe you wanted injection or you wanted vaccination, so you're going to the clinic and you're getting that shot and you're coming back to your home. So these kind of visits will be referred as outpatient coding. Okay, coming to see here examples, physicians or provider clinics. So usually one doctor, two doctor will be there in a clinic, and they will do all the minor things, minor procedure they will handle. But when I say inpatient coding, so in inpatient coding, what will happen? It requires an extensive treatment. Maybe the patient condition is so severe, so it may require ICU, or it may require longer term stays. Okay, so that means the patient is staying in the hospital more than 24 hours. Okay, so whenever patient is staying more than 24 hours, we will call it as inpatient setting. Okay, so now why I am discussing both these differences between outpatient and inpatient. Since you people are interested in CPC certification, okay, our CPC certification is all about our outpatient coding. Okay, so what is there in outpatient? All the minor procedure, moderate procedure, day-to-day life. Why CPC has more value? Because it has outpatient or professional coding. That means compared to severe problem, compared to moderate and minor problems, moderate and minor problems will be more volume, more visits will be there. Most, like out of 10 people, 2 people might have severe conditions. Okay, they are maybe old, they might have a heart attack, and they might have met with a severe accident. Okay, those are two person who are having severe problem, and out of the remaining 8, these people might have urinary tract infection, upper respiratory infection, or tonsillitis, pharyngitis. Okay, and maybe a minimal laceration, abscess, pain. Okay, these are all very moderate and minimal problems. This could be seen most of the time in the outpatient setting. Okay, the visits will be more compared to IP setting. And then coming to our code set. Okay, so what are the code set we have in the medical coding? We have first ICD-10-CM. ICD-10-CM stands for International Classification of Disease, 10th revision and clinical modification. Okay, so next CPT, current procedural terminology. Lastly, we have HCPCS, stand for Healthcare Common Procedure Coding System. And we do have one more code set, that is ICD-10-PCS, International Classification of Disease, 10th revision procedure coding system. So I'll come to this point later. So first let's understand these 3 coding systems. So for the CPC certification, or to be an outpatient or a profi coder, okay, 2 department. Outpatient is 1 department, and professional or profi coding we say. These are the 2 different departments in medical coding you will see. So for these 2 departments, they will ask for CPC certification. To get into CPC or to get into outpatient or profi roles, you must learn ICD-10-CM code set, CPT code set, and HCPCS code set. So now let's understand This ICD-10 codes will be used to report the diagnosis. Okay, why this patient is here? What is the problem? What is the problem of the patient? Okay, I already said maybe a cough is patient problem, or fever, abdominal pain, chest pain. Any patient concern or a problem will be reported using ICD-10 codes. Okay, this is for diagnosis, and it can be used in outpatient coding also and inpatient coding also. So this is the biggest advantage of ICD-10 Once you learn ICD-10 you can be enter as an outpatient coder also. You can enter as inpatient coder also. Like, opportunities are more. And next we have CPT, current procedural terminology. So this CPT will be used for what is the procedure, what kind of diagnostic test or a lab test, what exactly provider is doing in order to diagnose the problem. Okay, injection, labs, or any kind of operations, everything will be covered using CPT code set. And this CPT will be used in outpatient setting. Okay, outpatient setting. And we do use in inpatient setting, but that is a different process that you will not understand at this moment. So just think like CPT you are using for outpatient setting. Next we have HCPCS, Healthcare Common Procedure Coding System. So here you will see used for non-physician service. So it's not directly related to physician. Instead, it can be built for nurse practitioner, physician assistant. Okay, also some procedure codes we may not able to see in the CPT section. Those procedure will be listed in the HCPCS. Okay, so under HCPCS, we will have some codes like drug codes. Okay, injection code I will take from here. With that injection, what kind of drug they are using, the drug code I'm going to take from HCPCS section. Okay, so like drug, supplies, medical equipment. Medical equipment include like the patient is maybe injured, they need crutches, or maybe they need wheelchair. Okay, all those medical equipments will be coded using HCPCS codes. Okay, and then lastly we come to ICD-10 So here it says International Classification of Disease 10th Revision Procedure Coding System. So this ICD-10 we will not be using in outpatient setting or prophy setting at all. Okay, we will be using only for IP setting. IP setting includes whenever we are billing for a facility. Okay, not the individual provider. Instead, we are billing for an entire facility. So when we are coding for a facility service, we will utilize ICD-10 codes to report the procedures. Okay, but for diagnosis, what is the medical condition? That condition codes will be still coded using ICD-10 irrespective of whether the patient is being in outpatient or inpatient. Okay, for diagnosis, ICD-10 will be the permanent one. But for procedure, here we have option. Either sometime we take CPT codes, sometime we take ICD-10 codes. Okay, ICD-10 we will be using only when we are billing for a facility. What does it mean? Facility means, say for example, one hospital. Okay, there is one hospital, and assume there is one surgery going on. Okay, assume laparoscopic appendectomy is the procedure. Laparoscopic appendectomy is your procedure. So to perform this appendectomy, there is one surgeon, there is one nurse involved, maybe two nurses involved, one physician assistant involved. Okay, so there are 4 to 5 members involved in the single surgery. So now when they are initiating the payment, they will not just bill for the surgeon. Instead, it will be billed for the entire group. Okay, whoever involved in that procedure, everyone will be billed together. Okay, that is called facility coding. So when we are coding for facility alone, we will take the ICD-10 codes. And this ICD-10 is not a part of CPC certification. Okay, under CPC syllabus, you are not going to learn ICD-10 This is not the component of CPC certification because it's an exceptional. Like only when you decide to go with CCS certification, that time you will be learning ICD-10 PCS. but not in the CPC certification course, or for exam also not needed. Next, coming to let's talk about the billing also. So now, so far you understood what is medical coding. Like you understood, like you are going to read the medical record, and you are the primary person who are going to extract the diagnosis, procedure, and the treatment into alphanumeric codes. Okay, that is your duty, and you are called as medical coder. Now comes to billing. Okay, they are not going to read the medical record, they are not going to extract any codes. Instead, when they will work, when they will come into place medical billers, so you can see medical billing is a process of translating healthcare services into financial claims and submitting them insurance company for reimbursement. So under medical coding, you might have already extracted the required codes, and you might have already submit to insurance. But when you submit to insurance, you might have made some error. Okay, like you might have there are so many different errors we could see. Okay, coding error will be there, billing error will be there, eligibility verification error will be there. So many different errors we will expect. So just think, like, when under medical billing, what will happen? The payment will be denied or rejected. Okay, under medical billing, you get to see related to financial claims. Okay, there they may tell you why they are not paying for this patient, what is the concern. There will be explanation of benefits. Okay, EOB form will be sent. So you are going to read the EOB, you will understand why they are not ready to pay for the services for the patient, and you will figure out what is the cause. And you will work with, here you are not going to work with provider, instead you will be working with patient and the insurer. Okay, so you are a bridge now between patient and insurer. Okay, so any discrepancies are there from the patient end, sometimes patient is wrong, sometimes payer end is wrong. So you will, in middle, you will understand where is the root cause, and you will try to solve. And whoever needs to be reimbursed properly, that person will be reimbursed because of you. Okay, because you saw like you figure out what is the problem, and you will analyze what is the reason for the claim denial or a rejection, and you will have the solution with you, and you will again resubmit the claim with the corrected thing. Then again it will be resubmitted to or reimbursed to either provider or to the patient. Okay, so you are like a person who is taking care of financial claims. Everything related here, mostly 80% will be payment related. Okay, when I say medical billing, but when I say medical coding, it is coding. You are going to read the record, you are going to extract the codes. Okay, so medical billing compared to coding, medical billing is like, it is having a lesser value. Okay, because it is a secondary process, not the primary process. Primary process is your medical coding. So that's why medical coding will be having more scope and more value compared to medical billing. The medical billing, they will always have to be in night shift. Okay, here in India, because they want to speak to patient, they want to speak to insurance. So when they want to speak, means they cannot work like work as like in day shift. Okay, they have to be in the US time, so that they will have the night shift. Okay, that is about medical billing. And then again, so then after understanding all this coding and billing, now let's talk about this big entity. Big entity means RCM. Okay, everything is run under revenue cycle management. So what is revenue cycle management means? It is a end-to-end financial process used by healthcare providers to manage the revenue from the patient service. Like there are, you can just see here, please be on mute. So you can see here, this is an entire RCM cycle. Okay, so it is directly connected with your government, US healthcare. And here the process starts from patient registration. Okay, you are a patient, you're walking into clinic, there is a front desk officer, they're asking what is your name, what insurance you have, what is your concern today, everything. So from there, That is also one step. Patient registration is one step. Insurance verification is another step. Then medical coding will come. Claim preparation, claim submission, compliance check. Okay, payment posting. If payment is not posted, then there is a follow-up. This follow-up will be done by AR callers. Okay, AR, you might have heard about AR calling jobs. So that is a part of medical billing, not the coding process. Then denial management. Under denial management, sometime it is purely related to payment, sometime it is related to coding. When it is related to coding, they will send back to medical coding section. Okay, wherever made a mistake, not that person only receive, there will be another department as denial management. So under the denial coder, will able to see what is the mistake that medical coder has done. Okay, sometime this medical coder make mistakes like provider might have ordered the other test. He has built another code. Okay, sometime code and procedure discrepancy will be there. Sometime they might have missed adding appropriate diagnosis code. Okay, so many errors we will be seeing. Okay, so when it is related to coding, they will send to once again to coding department, and again the denial management coder will review and they will correct the claim, and then they will resubmit claim to the insurance. So then, yeah, so coming to the growth related to medical coding. So the scope and growth with the different medical coding specialities. So you can see already I have mentioned three different departments. One is profi coding. Profi coding means professional coding. Okay, professional. So professional is nothing but you are an expert. Okay, you are one surgeon, you are a cardiologist, and you are a expert. Okay, so you own your clinic. Also, you have invited from so many different hospital for hourly basis. Okay, they want you to be there in hospital. You go for 1 hour and you will see the patient, and you will go to another hospital. Okay, you work in multi hospital because you are an expert. Okay, that time we call them as a professionals. Okay, professional physician, profi physician. So they will have their one group NPI. Okay, national provider identification. We say every provider will have NPI, national provider identity. It's like kind of one number which is tied with his name. So according to his NPI, he will be getting paid. Okay, wherever he goes, he will charge hourly. He will not wait to get up money from the administration. Instead, we need to put his NPI. The payment directly should go to the physician, the professional physician's account. Okay, that is profi coding. So another outpatient coding means like urgent care facilities, and you have the clinic, you have 2 to 3 doctors. It is kind of a maybe a 50-bed hospital type, but not too advanced. Okay, that is, we call it as outpatient setting. And then we goes with IP. So with respect to that, we have so many different medical coding projects available in the market. Okay, you can be an IP coder, you can be an outpatient coder, you can be an emergency department coder, surgery coder, pediatric coder, radiology coder, pathology coder, any anesthesia coder, IVR, cardiology coder, dental coder, okay, obstetric and gynecology, OB coder. So all the different projects are there here in India. So we will have to, after CPC, like for CPC, like inpatient coding will also accept CPC, outpatient coding also accept CPC. Okay, that's why many employer, 95% of the employer will look for CPC certification, and few employers look for CCS certification, where their organization is only having inpatient projects. Okay, so that time, as I told, no, ICD-10 PCS, that you need to learn to be a IP, proper facility coder. So that time they ask CCS certification. Okay, so to start with, to get a good opportunities, we must go with CPC certification. As you can see, all of these are the different domains under medical coding. And these things, whatever I am adding here, this is not an entry level designations. This denial management sector or CDI, compliance coding, revenue cycle, health information management. All these are like once you have some 10 years of experience, or maybe 7 to 10 years of experience, and above 10 years, you can be in these roles. Okay, so where you are not be a coder anymore, but you will be in a leadership role where you have to oversee so many things that coders do. Then coming to, just before going to this, let's have one. So under career path, you can see here. So as after certification, maybe, after course, you may decide you may not have this, financial stability to invest on the certification. So you can also have an option to go as a non-certified coder. Okay, still job opportunities are there for non-certified coder also. So the company will hire you as a non-certified coder. All they want you to be, you should have undergone one course where you have learned all these basics things. Okay, what is ICD, what are the chapters we have, all these basics they will expect. So if you have that capacity or the skills, then they will take you as a medical coding trainee, okay, as a non-certified coder. So and then they, after 1 year or maybe 1.5 year, they are only going to sponsor for the certification. Okay, whatever the 78,000 exam fees is there, they will only pay behalf of you, and they will make you write the exam. Okay, they need credential refers to, this is like a CPC certification or any certifications. Once you pass the certification, you will have the valid license with you. Okay, so that license, using that license only, they can give you access to the EMRs. Okay, the because we have this, you will be handling, what you will be handling, the basic thing. See, you will be handling patient medical records, PHI. Okay, patient health information. So in US healthcare, the this PHI, what we say, protected health information, it is a one of the secured thing. Okay, it should be very secured. It should not be like here in India, we if one patient get cancer, whole colony or whole area will be knowing that this person is having cancer. Okay, same thing in any other condition also, everybody knows that. But in US healthcare, it should have the security that no one knows nothing about one patient thing, because this medical record contains so many personal information. They will have the security, social security number will be there, patient full name, patient email ID, patient phone number, okay, driving license number, insurance details, and the scan reports. Many things we can get to see as a coder. Okay, personal information, we will have access to their personal information. Okay, so that it should be handled using HIPAA security standards. HIPAA is a compliance rule. It will be integrated into all the corporate companies as well. And complete US healthcare, whatever the things that I'm explaining, payer, provider, all those, it is an entity that comes under HIPAA. You must adhere to HIPAA privacy rule, HIPAA security rule, all other rules what the HIPAA has, everything should be, please be on mute. Just a minute. Who is this? Okay, sure. Okay, so whatever we do as a medical coder, everything will be secured using HIPAA. Okay, HIPAA stands for Health Insurance Portability and Accountability Act. So it is established to secure a patient personal information. Okay, so there are so many rules. We will be following the HIPAA rules so that we will not be disclosing anything related to patient personal information to others. So that here, whatever after this, the trainee level, once you understand medical coding trainee level, here you will get to know which project you have been hired for, maybe surgery coding or ENM coding, anesthesia coding, whatever the project you have been hired, they are going to train you on that particular domain. Okay, so then once you get the confirmation, you will be moved as a junior coder. then senior coder, from senior to auditor, and educator. If you want to be educator, you can be educator. If not, you can skip that part. And then you will be having further role, okay, group coach, senior coach, process coach, team lead, manager. Then it purely depend on your individuality and how you will learn the subject in real time, and that will define your career path further. Okay, so you can see all the roles here I have mentioned. Later you can just see that. So now we will also discuss about the certifications. So best certifications, we have CPC, as most employer prefers to go with CPC. Everyone will go for CPC certification. Another one, we have CCA certification as an entry level coder. Okay. So now if you look into that, most of you will get confused. You say, you ask me, I want APC examination. You think APC itself a certification or AHIMA is a certification. No. Okay. So those two, APC and AHIMA, are two different educational bodies. Okay, two different educational bodies where they have their own certifications. Under APC, you will get to see some certification. Under AHIMA educational body, you get to see some certification. So employer will tell you which certification they are asking or they are looking. We need APC certifications. Then you need to take your certification under APC organization. Or if they are looking certification under AHIMA, then we go and take the certification under AHIMA. Okay, both are two different educational bodies. So now here CPC is from APC. Okay, CPC stands for Certified Professional Coder, and this administered or given by AAPC, American Academy of Professional Coders. Okay, and it is widely recognized in the medical coding industry. Both in India and USA, CPC is in demand. And then coming to exam fees. Okay, leave about the course fee. Course fee also varies somewhere between 25 to 30,000 if you go to offline institutes, or anywhere if you prefer to go with, it will be a same, because exam book will be higher at like some $244 exam book only will be there. Okay, so it will be a the higher thing, the course will be like, that's why they will be charging more. Then you will be having for $540, you can get to have two exam attempts, two exam vouchers you can have for $540. And only $540, you can't purchase two attempts. Before going to purchasing the exam voucher, you must be a member of AAPC. First, you need to have membership with the AAPC, and along with your membership, you can get to purchase vouchers. Okay, that means we will be having certain amount, around 78,000 will come together in INR. So that needs to be paid to write the CPC exam. Okay, so that is given, or that decision you have to take only after taking the course. Okay, because what most of the coders or students will do, they will take initial exam commitment. They will pay 1 lakh together, 78,000 exam fees and maybe 30,000 course fee together. And then what will happen after course, they may understand the subject, they may not understand the subject, but you already paid the exam fees, you must write the exam. There will be no flexibility for you. Okay, at least when you only opt the course, you will get to explore the thing, and you can get to decide whether it suits you, or you can learn this subject, or you feel like it's hectic for you, or it is okay for you. All the decisions can be made only after taking the course. Okay, that's why your flexibility is very important, and you need to take the decision accordingly. Next comes to exam format. It's 100 marks, 4 hours duration, and you must obtain 70% and more to get the CPC credential. Okay, that means 70 out of 100 you have to score 70 marks, then only will be referred as pass. Okay, if you get 69, you will still be called as fail. Maybe if you fail in the first attempt, you will have one more attempt with the same fees. You don't have to pay anything here, because you already have that one voucher with you. So you can redeem that voucher and you can write once again the exam. Okay, once you have the CPC, then you will be considered as a certified coder, and then you can look out for the certified jobs. Okay, so the salary comes to salary, non-certified coder and certified coder, around 6 to 7,000 difference will be there. Okay, so you have to uh, like, based on your individual decision, based on your financial things, you have to plan that. Okay, and then coming to AHIMA also offer one entry level certificate. CCS is not an entry level certificate. At least you need some 2 years of experience, then only you can go for CCS. Now fresher will also go with CCS, but limited opportunities. Okay, when they are looking for CCS certification, employers, they don't look for a fresher. They expect at least you should have 2 years of experience. So then what's the point getting CCS certificate? Okay, but AHIMA offer CCA, but here in India it is not even known. Okay, nobody knows also CCA certification. So this
हा
CCA refers to,
येते आता हा पप्पा गेला आता पा लाईट चालू हे बंद झालं ना आता
okay, so CCS stands for Certified Coding Associate, and here it will be having single attempt, and it will cost you around $200, and membership will cost you $100. Okay, so this is the exam fees details, and this will be, you have to think about this after completing your course. Okay, not now. I mean, if you have the clarity to go with certification, well and good. If you don't have clarity, you want to explore and learn first, then keep your certification after course. I mean, for 1 month of proper preparation or 1.5 month later, you can decide. Okay, and then what to say, as we have non-certified coding option also, like the jobs are available. Based on your thing, you can decide if you will be able to pay exam fees. A few student parents will say, okay, first you get the certification, then your path will be easy. And few parents may say, like, try to get a job as a non-certified coder. Okay, so it depends on every families. Okay, so that's why in my course I don't take the exam fees initial itself. I don't ask anyone to pay exam fees right upfront. I don't ask. After course, after your preparation, you can come back and you can ask me that I am ready for to write the exam and book me a slot. Okay, that time I will help. And then uh, to salary, so I think I've explained in the recording. Okay, so the coding salary expectations, you can see, as a non-certified medical coder, you will expect the salary between 18 to 20,000. And here you will be having medical coding training. Okay, training will be an hectic thing, and they will be always spending a lot of money on training sessions, because whatever the software access they will give you, it will be an individual access. Okay, if you are giving you one access to one software on your name, it will be a single device access. No, for each system they have to buy the access. So that access itself cost around $300, $350 per month. Okay, so they will be already paying a lot of money, so that they will generally not ready to pay more salary when you are in the training period. Okay, everything you need to learn. You want to be, they expect you to be an individual coder. So the initial 6 months, you just have to learn. That's it. Okay, after 6 months only, your actual journey will start as a medical coder. By then, you will be learned a lot. You will be an independent, and you can work alone. And certified medical coder salary ranges between 21 to 23,000, and also you can expect 25 to 27,000. Okay, based on project, they will decide, and they will give the salary. So generally, you can keep an approximate 23 to 27,000 as a initial medical coder level. Okay, anything less than that, if you are getting, you should look out for what kind of project they have hired you, and what are the things that they are giving training for. Okay, if you feel like, okay, outside the same training is costing me 1,60,000, 1,70,000, the same training I can get with them, and I can also get the experience with them. initial one of, I mean 6 months, you can accept that. Okay, that will be a good opportunity only. And then in medical coding, it will be incentives will be more, because you work as a what to say, turnaround time. What we have, every RCM person, say for example, assume you are one, you have one clinic. Okay, you have one clinic, and this clinic provider name, like assume he XYZ is a provider name. He sees every day around 50 patients. 50 patients he see in his clinic every day. So this 50 records, medical records, by that day itself or maybe next day, medical coder can access. What this physician will expect, all this 50 record needs to be submitted to insurance, maybe within 1 day or within 2 days. Okay, that is called turnaround time. Because this XYZ physician, though he is seeing 50 patients, he will not getting any money until he should get reimbursed from the insurance. Till that time, he will not be having any money. Okay, because it's not like direct payment, right? Then no one is giving him cash. He needs to wait for the patient insurance to reimburse to the provider, so that he will ask the entity or the organization, whoever handling his clinic, he will ask them. He will put one turnaround time. I expect my medical record needs to be submitted or needs to be paid in 24 hours, or maybe in 48 hours or 78 hours. Likewise, there will be TAT for each provider. Based on the TAT, they will work it. Okay, they will work and they will schedule the visits. So if it's not a coder level, I mean entry level, you will not be having such things. But once you are experienced, 1 year or 2 year, and you have good hands-on experience on medical coding, you are coding very well, and you can handle so many clients as well. That time you can utilize the opportunity. Instead of coding 50 charts, you can code 70 charts, 80 charts, based on your knowledge, because it will be repetitive. I mean, once you understand how to code for curve, it will be there in your mind. Once again you see the same curve chart, maybe in the initial visit you might have taken 5 minutes to code that chart. Next day you will be taking 1.5 minutes to 2 minutes to code the same chart. Okay, with like that, with experience, you will get to see, you will have a lot of exposure, and you will get to see you will get used to that particular clinic, and it will become easier for you. So at that time you can push more clients, you can do more production, and you can expect a good incentives from your company as well. Okay, that is another advantage as a medical coder. So many medical coders, what they will do, they might be getting CTC as maybe 35,000, 40,000, but their incentives itself, they'll be getting around 25,000 and 26,000, or sometimes somewhere between 15 to 20,000 incentives additionally they will be getting. Okay, so if you are really willing to work, it is again left to you, right? If you want to work, you can utilize the opportunity. If you cannot work, then you can go with your whatever the CTC you are getting, that will be your salary. Okay, so then medical coding opportunities, as I already said, you will be, it is a global demand. Okay, medical coding is a global demand. So if you remember, whatever the graduation you might have done, okay, I am not sure who are worked in I mean, who are from B pharmacy background, or M pharmacy, BSc, life science or non life science, all of, I don't know your graduations, right? But up to 2020, there were a lot of medical other sector opportunities also. If you are doing B pharmacy as your graduation, after B pharmacy you are going to some regulatory affair, or maybe pharmacovigilance, likewise some clinical research. So many other sections are there. With respect to pharmacy, you are going and getting job there. There were jobs. Okay, and same way, if you are done microbiology, there were job for microbiologist, and you are getting job under microbiology section. Biotechnology, you are having biotechnology jobs, like you have the jobs. But what happened after 2020? It is like all limited, it became very limited. Job opportunities started limiting. So then what happened? Every life science graduates got to know about medical coding. Oh, there is one medical coding. In medical coding they accept all the graduations. Life science graduations include, BPT, pharmacy, life science. Okay, non life science also they will accept when you have the CPC certification. But only few companies may say, like when it is completely related to HR, those HR will say like non life science we will not take. But if you have the CPC, like when the hiring starts, when the bulk hiring is there, that time again they will take you also. Okay, but compared to life science you will have some limited opportunities. In USA they don't see whether you belongs to life science or non life science. That will not matter in the USA. And then here, from 2020, once COVID or pandemic happened, that time medical coding, it was very demand. It was in high demand because we used to get in lakhs. Though I was maybe a senior coder, I used to code a lot of climb, and we used to get 95,000, 1 lakh. Okay, from it was like incentives only. We were getting triplex. Okay, that time, because one small clinic every day this doctor might seeing only 5 patients. But when pandemic happened, in the same clinic the doctor was seeing around 100 to 150 patients. So where to where, how to code? Okay, he expect us to code, you please complete 150 charts within 2 days. Okay, I will do it, I give me incentive. Okay, so they will pay. Likewise, after pandemic they understood the usage, or they understood the importance of medical coding both in the government level and as a job opportunity level. So then the CPC certification, before this CPC certification was not mandatory. Like once you got like once you got into job, then the employer were asking you to make, or take the certification. Certification will be good. But later what happened? Because of all this additional, all other job sections started looking job under medical coding, they started to screen. Okay, how do they screen? At least if you are certified initially, I can think like, okay, you are having good knowledge, and I can utilize your license also, and I can utilize your knowledge also. Okay, that time they put the screening as your certification. Okay, so now you compare, you sit and think. You might be a doctor, you might be, BPT section, B pharmacy section, but when you look into your job sector, you might have not getting jobs. Okay, that is one suggestion I'll give you. First, you check, you research on your field. If you are getting a job there, and think about or compare. Okay, what if I go to medical coding, or what if I go to clinical research? What is the difference here? Which one I should opt? I will leave it to your decision. You should not get influenced by anyone. First of all, why, what you studied, what is your academy? You studied to be a microbiologist means you should first look to be a microbiologist. If you're not at all getting the job, then you need to switch your path. Okay, so there will be a room for all of them. That is medical coding. Okay, so that is what I suggest to everyone. And here flexible opportunities will be there. So based on project, once you prove yourself that you can be a good medical coder and you give good accuracy and production, they will, every like 60% of the company will try to give you work from home. Okay, they want production, you want work from home. So they will, once you understand, once they know you. Okay, like randomly they cannot give you work from home as a fresher, because it is, again, as I said, compliance risk will be there. Once you know them, once you have the trust with the employer, then they will give you work from home. Okay, and then salary, as I said, entry level to certification, you will be getting a decent salary. And after 1 year of 2 years of experience, how you will move your career, I mean, the level that I have designation I showed here, coder, junior coder, senior coder, and once you move to auditor, from here your leadership role will start. Okay, here no more be a coder. You will be having only auditing task, only training task. Okay, and from here you need to upgrade, upskill. You know, you have to get another certification. What is needed for your project? Likewise, you need to be a very individual, independent. From here, you need to like build your career further. Okay, up to here only your basic thing, whatever you are learning in the course, ICD, CPT, everything will help you until you become a senior coder. Once you become auditor, then you are in a leadership role. Then all other things you need to learn, what is required, what is not required, everything you will figure out. By that time you will have enough exposure, enough experience, so that time you will be aware. Okay, and then so then also some people will be questioning me that what about this artificial intelligence? How do we handle if AI replace every medical coders and all? Okay, so now think about medical coding only. Okay, so in medical coding from 2020 to 2021, 20 to 23, we were using already automation. Okay, it is not directly AI. It is not, we cannot say it is artificial intelligence. Instead, there are robots, the utilizing robotic process, they are automating few things which can be automated without any clinical judgments. Okay, but not the medical coding portion. Coding they have not automated. Using robotic process, it will suggest the codes, but validation will be done by medical coder only. Okay, and why they can't integrate AI into the software? Because compliance risk. Once you give anything, like say for example, if you use ChatGPT or any AI tools, if you once feed them about your personal information, it will remember it forever. It will tell you, okay, on this day you said this to me. Like it will tell you, hi Chandrika, it will tell you, or your name, everything it knows. So when you put patient medical records into AI, it will be a compliance breach. Okay, that's why no companies or no medical coding sectors are entertaining complete automations. Okay, that's why healthcare will be in a safer side. Okay, when it comes to that to patient medical record, it will be always in the safer side. Only automotive things. Automotive means data entry or maybe some repetitive task. All those can be without giving information about the patient. Whatever can be automated, that portion will be automated. Okay, but not the human things what they are doing. The coding error analysis and how to code. If the denials comes, how to handle, everything will be done by medical coder and auditor only. Okay, so it will help you in so many different ways. It will help to have a good accuracy and production, but not going to replace everyone. Okay, and also what to say, this one, we will have frequent updates. Okay, we will work on pair policies, we will have work on physician policies. They will keep on sending updates every 15 days to 20 days, like this rule needs to be changed, while coding you follow this policy, this rule. So this frequent updates, they can't cope up with the AI. Okay, so all this whatever the human coders are there, they can analyze and they can do this work. Okay, so that's why you don't have to worry, at least until next 5 to 8 years you will not be even worried about AI. Then after that, if anything comes to particularly for healthcare setting, particularly for medical coding, then you should think about. Okay, now whatever the AI is there, it is general. It is not only impacting your one section, it is giving value for all the sections. Okay, chat gpt is there. With using chat gpt or using cloud, you will be able to navigate so many different things. It is a general. Okay, it is helping you. Okay, so it's not going to replace, not going to replace. So instead we need to upgrade. We need to know what is happening in the market. Accordingly we should grow. Okay, and then let's see one example. Okay, so let's one have a quick example. Yeah, I was referring this Okay, so this is how your medical chart will look like. Okay, this is how same thing will be seeing you will be seeing on the screen. So if you see this chief complaint CC, okay, then they are saying patient complaints cough. Okay, this is the first example. Let me take the second one. Okay, so patient complaints burning, urination, right knee pain, and left forearm pain. These three are the patient concern. Okay, not the problem is not being identified, but as a patient you know the symptoms only. I am having pain in the knee, I am also having pain in the forearm, and while urinating I have burning sensation. All you know is this much only. Whether you have UTI or you don't have UTI, you are not sure. That can be diagnosed after examining. Okay, the provider will examine and then he will tell you you have UTI or not. Okay, so now in this level it is only a symptoms. Next, history of presenting illness. Here there will be elaboration. So 60-year-old female present with burning sensation during urination, increased urinary frequency, there is suprapubic discomfort. So see, from 3 days, so all this information are there. Past medical history, patient is having type 2 diabetes mellitus, patient is also having hypertension, and history of recurrent urine tract infection. This is a history. This patient was recurrent means like maybe every year once or every month patient is getting UTI infection. Okay, patient is getting UTI infection. So that's why they have mentioned recurrent UTI. And no history of kidney disease, no past surgery is reported. Medical history, patient is currently taking metformin 500 mg twice a day, daily, and also on another tablet. Allergies, no known drug allergies. Okay, then review of system. What are the system that they are reviewing? So genitourinary they have reviewed, musculoskeletal they have reviewed, and then respiratory, cardiovascular, all the systems are reviewed. When you look into genitourinary, the doctor noted that patient is having positive dysuria and urinary frequency. And then musculoskeletal, please be on mute until I complete. Later you can have your questions. So then musculoskeletal, again positive for right knee pain and left forearm pain. As you can see, these two systems have problem. Another thing, respiratory, Denny's cough or shortness of breath. Denny's means there is no cough or there is no shortness of breath. Okay, when it comes to respiratory. Same way when it comes to cardiovascular, then is chest pain and palpitation. There is no chest pain and there is no palpitation, the provider noted. In physical examination, how the physical appearance of the patient, how he is looking. So patient general, he is alert and there is no acute distress. Abdomen, as he mentioned, there is a pain, there is a tenderness in the abdomen. Right knee, there is again pain in the right knee and there is also pain in the forearm. Then they are taking vitals, BP they have took, and again temperature, oxygen, everything they have, saturation, O2 saturation, everything is listed under vitals. So now coming to our procedure. Okay, he understood patient is having urinary frequency, patient is having pain in the knee, patient is also having pain in the left forearm. These are the problems of the patient. In order to diagnose what exactly happening with this patient, now provider needs to do the procedures. So see what are the procedure he is performing. He is performing urine analysis and urine culture. Okay, these are the two labs he ordered. Then he also ordered, physician also ordered X-ray right knee, 2 views X-ray, X-ray left arm, left forearm, 2 views X-ray. So now these are the procedure that the provider did. Okay, so now next look into the results. After ordering lab, he also needs to review the result. So there is a lab result out. Under urine analysis, there is a leukocytes positive, and again WBCs are elevated. Coming to urine culture, there is a growth of E. coli. Okay, there is a growth of E. coli. So that means there is a positive for what? UTI. Okay, urinary tract infection. So then radiology report is also out. Right knee X-ray they have done, normal study. Left forearm X-ray, again normal study. Okay, negative. So X-ray result is there, lab result is there. So using the lab result and X-ray result, now he need to establish the final diagnosis. Okay, the diagnosis include patient is currently having urinary tract infection as confirmed because urine culture, urine analysis and urine culture had a positive result. So UTI is confirmed. Then X-ray, why they have performed X-ray? Because patient had a right knee pain, patient had a left forearm pain, that is also problems. Then again patient already currently chronic conditions, patient is already having type 2 diabetes mellitus and hypertension. Both chronic conditions are stable or controlled. That means they are taking drug, they are taking metformin for diabetes, and using the drug patient diabetes is controlled. Okay, but since it's a chronic condition, the provider must document it in his final diagnosis also. So there are 5 diagnoses. Okay, 5 diagnoses are there in this record. And then lastly, what is the treatment? What treatment he has given? Administered intramuscular ceftriaxone injection in the clinic. Okay, this is again ceftriaxone injection will be again considered as procedure. Injection is procedure. And whatever the drug ceftriaxone they've injected, it will be considered as drug or supplies. Okay, so the code we will be taking under HCPCS section. So next, like they have given general instruction, and also he has given follow up in 3 to 5 days. Okay, 3 to 5 days. He again with next 3 to 5 days, patient has to go back to the same clinic. Okay, so now simple, whatever I have explained, you tell me for this to report this diagnosis, what ICD sorry, I only already told what which coding system we will use.
ICD.
ICD will be used to report this diagnosis. Okay. Same way, there are procedure here. X-ray is there, urine analysis is there. So to code all of these procedure, we will be taking
CPT.
PPT code.
correct. Okay, CPT we will be using. And again, in last, as I said, there is a intramuscular injection, and they have used ceftriaxone drug. For this
HCPC.
drug, we will be using
HCPC.
HCPCS code. Okay, correct. Okay, this is what we are going to learn and in detail. So now I will also enter the codes since I know. Just you see this one. Where is this? Just a minute. Okay, so this is how your charge entry will look like. Okay, you will be having patient name, you will have the medical record number, and you will also see the doctor name and the insurance company that you are billing for. Okay, now assume there is one dose. So this whatever the chart we have currently seeing, assume this chart being uh, examined on 2/24 2026, and you are referring this or you are coding this chart on next day, maybe 2/25. Okay, likewise you will keep the date of surgery or date of service. Okay, here you will have the dates, it will be automated, the dates will pick automatically. Then facility or the setting refers to where, in which outpatient setting, which clinic name, hospital name will be there here in the column. Next, we have place of service. Place of service means when we start the subject, you will get to see place of service means we have some codes. Okay, you can see here there are some codes. These codes will these codes are designated to give the information to the insurance where the service was given. Say for example, it was given in the urgent care facility. Okay, outpatient, assume outpatient, off campus outpatient hospital or on campus outpatient hospital. This will be written in the medical claim. So seeing that if they are mentioned urgent care facility, you will enter place of service code as 20. Okay, so let's keep maybe this is West Care Hospital, no? So hospital will be 20. Emergency room hospital will be 23 or 21. Okay, based on inpatient or ED, we will take the code. But when you look into the chart, in this chart, here they are specifying ED physician, emergency department physician. So let's keep place of service code as 23. Okay, you can see here in the book, 23 refers to emergency room hospital. So this is the service where patient is taking the service. So 23 tell us this service was rendered in the emergency room of the hospital. Okay, so that is what place of service means. So next, another thing, let's see the CPT now. So now while entering CPT, so now you have to tell me that first I'll show the index. Okay, so this is what we are going to learn. Okay, so each chapter, every chapter we need to learn under CPT. So I'll just show you. So if you see, this is a CPT index. So we have codes for anesthesia section, we have code for surgery section, we have code for radiology section, pathology and laboratory section, okay, medicine and evaluation and management. So up to here, up to 99499, what you're seeing, from 0 series code to 99 series code, you're going to learn in the CPC course. And same will be applied for all the outpatient thing. Nothing comes out of this. Only you are able to see these code range in your real-time coding also. Okay. So now just tell me, they were ordering labs. Okay. Lab test. So by looking into this screen, from where I can take the CPT code for labs? From which series?
Pathology and laboratory.
Pathology and laboratory position.
Correct. Okay, so from pathology and laboratory, I have to take the code for urine analysis and urine culture. Okay, so there will be codes for urine analysis. Say for example, assume urine analysis code. I know I'm entering, but later I will be showing you through book how we will be getting the codes. So as you can see, 81002 and 81003, we have so many codes. Just for now, urine analysis I'll take. 81002 will be my CPT code for the lab that the provider ordered. Okay, let me keep urine analysis code 81002. One CPT is done. One procedure code, I got it. Another, what is the another lab they have ordered? They have also ordered urine culture. Okay, they have ordered urine culture also. So this CPT code also I need to give. So urine culture code is okay. You can see culture, urine culture code is 87086. So I'll enter that also. You need to enter in a different row, but for time being, I'm just entering 87086, another CPT code. Okay. Okay, so we are done with the lab CPTs. Procedure we are done. And again, if you apart from labs, they've also ordered X-ray. Okay, right knee X-ray, left forearm X-ray, 2 X-ray they have ordered. So again, by looking into index, from which series you are going to take X-ray code, or it belongs to which section? X-ray
Radiology procedure.
Radiology procedures. Okay, so from here you will take the X-ray code. So I will enter the code. Knee X-ray, no, 7356. Okay, so radial, you can see here codes are varying based on the number of views that provider mentioned. So our provider mentioned how many views he took. X-ray, right knee 2 views, left arm 2 views. So you need to get the code for 2 views now. So if you look into knee X-ray, 73560 says radiologic examination of knee 1 or 2 views. Okay, so in this description you can see that. So 73560 will be the correct answer, correct CPT code. So I will also enter 73560 for knee X-ray. And then there is a forearm X-ray, left forearm X-ray also there. So forearm X-ray code. Again, you can see here 7390 radiologic examination of forearm 2 views. Okay, forearm 2 views code is 73090. So let me enter that also, 73090. Okay, these are the 4 CPTs. And once again, if you look into the medical chart, after the X-ray, what is the one more procedure they have performed here? Administered intramuscular injection. Okay, injection also needs to be coded now. So injection intramuscular 9637. So just for your reference, I'm showing. See here, 96372 says injection route of administration is subcutaneous or intramuscular. Okay, in our chart, the doctor gave injection through intramuscular route. If he has given through intra-arterial, then I would have taken 96373. But as of now, I have to go with 96372. Okay, 96372 is my injection code. I will enter this also, 372. Okay, and then comes to, lastly, there was what is this? HCPCS code. Okay, HCPCS of ceftriaxone. Okay, ceftriaxone HCPCS code I need to find out now. So what here, we will have the book also, HCPCS. You don't have to look codes in the book when you are coding real time, but CPC exam you need to refer the books. So see here, just see this. So drug codes, these are HCPCS codes. So drug administered other than oral method. Other than oral method means what? Oral method means they're giving drug through
Mouth.
through mouth. Okay, correct. Now they have given injection through intramuscular. So will this index is correct or not?
Correct.
Correct. Okay, drug administered other than oral method. So from this code range, I need to look out for my ceftriaxone, HCPCS code. Okay, so if we go and refer, maybe just a minute, 311. Okay, so there are so many injection or drug name will be there. Okay, so see here, J0696 code says ceftriaxone sodium. Okay, this is the drug they have administered. So from HCPCS, I will take my code J0696 as my last code. Okay, so now I am done with my CPT section. I am done with my procedure coding. So now I have to code for the diagnosis. Diagnosis will be done by which code set?
ICD 10 cm.
ICD 10 cm. Okay, so that okay, so here also you can see this ICD. Under ICD we have 22 chapters. So each chapters will be organized based on the body systems. Okay, and also the particular cause. See here, A series, code starting from A series, which is related to infections like HIV, sepsis, all those infectious condition we can get to see in this code range. Same way neoplasm. Neoplasm means cancer. Okay, sometime malignant, sometime benign. Okay, secondary cancer, all those cancer related codes we will be seeing in the code range C00 to D49. And then endocrine related, diabetes and obesity, all those conditions here, E series. Mental and behavioral and neurodevelopmental disorder under F series. Disease of nervous system, anything related to nervous system conditions, we will have the code from the category G00 to G99. And eye related, ocular pain, and anything related to eye related conditions, glaucoma. Okay, all those conditions we will see in the H series. And same way here also H series only. So you can just see here. So if I say upper respiratory infection, which system, which organ system you will refer? Yeah.
Lungs.
That means which
Lungs.
system? It will be
Respiratory system.
J.
respiratory.
Respiratory system.
Okay, respiratory system. You will go and check the code under respiratory system. Same way as I already said, assume there is a condition like urinary tract infection. Patient is having urinary tract infection.
Genitourinary system.
Genitourinary system. Correct. Patient is having shoulder fracture.
Musculoskeletal.
Musculoskeletal system and connective.
Correct. Okay. And any condition related to skin lesion, skin tag.
Disease of the skin and
subcutaneous.
Correct. Okay. And GERD related to gastro, any
Digestive
conditions?
system.
digestive system.
Yes, digestive
Okay.
system.
And same way otitis media, ear. Okay.
Ear and mastoid.
Correct. And circulatory. If I say hypertension, patient is having hypertension. It comes
Circulatory.
under
Circulatory
circulatory.
system.
Correct. Okay. And if I say patient is having brain cancer,
Neoplasm.
neoplasm. Okay. Likewise, you have codes, 22 chapters we have under ICD. We need to study all this chapter by chapter. One day we need to discuss certain infection and parasitic disease only, and the code guidelines what we have for this. So likewise we need to discuss all the 22 chapters. So now for our just for a demonstration, now let's have a look on our ICD conditions. So patient is having urinary tract infection. Okay, I need to get the code for urinary tract infection. So just, I know the code, I'll be entering. Just see the code, okay? As you already said, urinary tract infection belongs to genitourinary system.
Genitourinary.
And the code starts from which series? The alphabet?
N00 to N99.
N. Okay, so let's take ICD 10 so that I will have a cross reference. Okay, so let's keep. So you can see N39.0, it says urinary tract infection, site not specified. Okay, I got UTI information alone. So I'll be entering UTI code as N39.0. Okay, N39.0. Now let's enter N39.0 here. Okay, so this is like linking. For urine analysis, they have urine analysis they did for which reason? Is it for shoulder pain or urinary frequency or urinary burning urination?
Burning urine.
Okay, correct. It is not. They have ordered urine analysis and urine culture to diagnose problem related to genitourinary. So when I am reporting CPT to the corresponding ICD, it should have the medical necessity we say. Okay, this and all in depth we will learn in the course. So now I will add the same ICD N39.0 and for urinary culture also. Next I have X-ray code. One X-ray forearm pain. Another one is knee pain. First one is knee pain. So knee pain, as you can see, where you can get the knee pain code, from which series? Just mention the alphabet.
Skeleton.
From
M00 to M99.
correct. Okay, from this series we get to see knee pain and forearm pain both. So M25 561. Okay, so you can just look into these codes. M25561 says pain in the right knee. Okay, so pain in the right knee will be the code for right knee X-ray. So for this, I need to code diagnosis code as M25561. Same way, another X-ray is there, 73090, which is forearm X-ray, and which side also important. This was right knee, ordered right knee X-ray. So I should give M25561. I can't go and assign left knee code. Okay, because patient had a problem in right knee, and right knee is a diagnosis. So I should utilize right side of the right side as a laterality I should use. Same way, another X-ray, it is for left forearm. So I should take left forearm pain code will be M79. Okay, so pain in left forearm. So this I will enter to my M79. This whatever the code I have, X-ray code I will be entering here. Okay, sorry, M79632. So just for reference, okay, I'm not entering properly here. So okay, and then we have injection. So when it comes to injection, we need to check injection was given for which reason, whether it is for urinary tract infection or for pain. So here they did not specify anything and they gave general. Okay, so you can either add any pain code from M25361 or 632, or maybe urinary tract ICD, anything you can add here, no problem. And for drug also, you can add in UTI or pain, any ICD you can add here. Okay, just to say this service was rendered because of this problem. Okay, likewise, you will enter the diagnosis codes also using ICD-10 CM codes. Next, if you look into, there is one more thing, modifier. This modifier in tomorrow class, we will learn what is modifier in depth. This is a basic thing. From modifier, we will start. Modifier and billing and compliance, everything day by day we will start. And from Monday, we will start the ICD portion. Okay, because it's basic. Once ICD is over, we will move to CPT section as it is advanced. So now, in the modifier section, what and all thing will be there? Modifier will be 2-digit number. It will act as an like it will give you some information. It will give insurer, it will tell some information about the codes. Okay, we have so many modifier. Each modifier I will explain. See, we have so many modifier here. When to use this modifier, everything with scenario I will be explaining in the further sessions. So now just for this chart, let's have modifier. So where we can use modifier means here X-ray they have performed. One X-ray was right knee, another X-ray was left forearm. So there is a laterality here. So we in our code it is not stating maybe CPT code it is not stating right knee or left knee. It was only stating knee to X-ray views. So I can use my modifier and I can tell this X-ray was performed left side of the patient or right side of the patient. For that, I will be having modifiers. So see here, we have LT modifier. LT we will be using for left side of the body. Whenever they perform procedure on left side, you can utilize LT to determine the laterality. Same way you have RT modifier. RT if you enter, it says this procedure was done on the right side of the patient body. Okay, this is just an information that you are giving to insurer. So that here in this chart, I can enter the first one, right knee, they have did X-ray, so I can enter RT modifier, and another one left forearm, so I can enter LT modifier under modifier column. Okay, and quantity will be there. How many quantity? One lab performed one time only. Urine culture also one time. X-ray one time. Everything one time only they have performed. And there will be assigned charges also. With each CPT, there will be assigned dollar value you can see on the claim. Okay, and insurance. It will this payment whatever you have on the claim, it will be reimbursed from whom? So here patient is having Cigna insurance. So you are going to assign it for Cigna insurance. Okay, like this we will be coding in real time. So now to reach this level, you need to know all the things chapter wise. Okay, so when I say the course, okay, whatever the course, the people who have joined, I think I have already given you the medical terminology and anatomy questions. Okay, that is a bundle. If you refer that, that is enough. And also when we start the CPT section, there in every chapter you will get to see lot of anatomy, lot of medical terminology terms where I'll be explaining during the classes only. So now check out this. Okay, if you want to be a CPC certified coder, this is the marks distribution that we have for CPC certification. So course will be designed based on the CPC certification modules, I mean the marks distribution. So in this CPC, 67 marks you can get from CPT section alone. Okay, CPT section, from CPT alone 67 marks you will get, and from ICD you will be getting around 5 to 10 marks. Okay,